This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Awesome. Hi, everyone. My name is Ben. I'm one of the fourth year chief residents for Indiana University. Let me just get our presentation pulled up here. Both myself and our program director, Dr. Nathan Pravo, are on this call. At any point, feel free to message either of us with questions, and we'll try and answer those towards the end. Am I able to share my screen? I think so. Is everybody able to see this?
Yep, we can see it. As soon as you pull up your presentation, it should be good to go.
Oh, it's pulled up. Let me try and see if is it working or no?
We can see that you shared your screen, but the presentation itself is a black screen, unfortunately.
Okay, let me just share the desktop view. Sometimes that works easier.
Perfect.
All right. How about now?
Good to go. Excellent.
There we go. Awesome. Thanks for your patience, everyone. Like I said, my name's Ben. I'm one of our fourth year chief residents. A little bit about me. Interested in sports medicine, currently on the application trail myself. So I feel your pain right now going through ERAS. Enjoy traveling, trying new food, spending time with friends. There's me with one of our faculty and former residents doing some sports coverage, and me on a recent vacation. A little bit more about our department. So we were founded in 1991 by Dr. Randy Bradham. Some of you may have heard of the Bradham textbook, one of the key foundational texts of PM&R. We're part of over 100 accredited programs and non-accredited programs at Indiana University School of Medicine, with over 1,400 students and 1,200 residents and fellows as part of our training environment. We're located in Indianapolis, just adjacent to the Indiana and Purdue University Indianapolis campuses. Really great for a lot of collaboration and ease of being downtown. Some of the hospitals and clinics that we work at. So we rotated a few different sites throughout our time at IU. Our primary inpatient location is the Rehab Hospital of Indiana, which is about maybe 15 minutes west of downtown Indianapolis, maybe even a little bit less in the mornings with light traffic. It's a standalone facility with about 91 beds. Currently, we have 5 different units there. So we do our stroke rehab, traumatic brain injury, spinal cord injury, complex medical, and we also recently started a cancer rehab team there as well. So we have inpatient opportunities to work with all of those disciplines at a standalone facility where you really get to be, truly the primary provider taking care of these patients, which is a great experience. We do both inpatient and outpatient pediatrics at Riley Hospital for Children. It's a really great hospital. I think last I looked, they were nationally ranked in 10 or 12 different pediatric specialties and one of the top 3 children's hospitals in the Midwest region, according to U.S. News and World Report. We have a VA medical center that we rotate at as well. We do both inpatient and outpatient rotations there, as well as the opportunity to do elective rotations as well. Outpatient rotations there encompass pain medicine, general MSK. We have a chronic pain as well as an interventional pain rotations and opportunities to work with orthotics and prosthetics, which is really cool experience at the VA because you don't have to deal with insurance. You can really kind of get the patients exactly, what they need and what they qualify for without the headaches. So it makes it, more likely that you're going to see some higher end prosthetics there. Unfortunately, I will not be here to see this, but IU is currently replacing our 2 main hospitals and building one newer, bigger, better, larger flagship academic health center, which is going to really consolidate all of the different services across Indiana University School of Medicine and IU Health into one area. Not sure exactly what our department's role will be in that, but I expect it will include both some outpatient clinic rotations as well as our consult rotations. The Neuroscience Center, located about a 5-minute walk from the current IU Methodist Hospital, is where we do a majority of our outpatient rotations. We have our sports medicine rotations there, general rehab outpatient, as well as some of our interventional sports and spine rotations there. And then we have a few other outpatient clinics located at some of our affiliate hospitals, IU West and IU North, which are just other branches of IU Health, located roughly 20 minutes north and 20 minutes west of downtown Indianapolis, respectively. In terms of our curriculum, so like I mentioned earlier, most of our inpatient rotations occur at the Rehab Hospital of Indiana, RHI. During our second year, we do 2 months of stroke, traumatic brain injury, spinal cord injury, and 1 month of complex medical. And then we return in our 4th years to do another inpatient month of complex medical at RHI. This gives our residents a good experience to have, some inpatient rotations, prior to boards, but also prior to graduation for those residents who want to go directly into practice and, kind of need a little bit refresher on inpatient if that's the direction they're going into. We do 3 months of pediatrics at the Riley Hospital, and then, I guess for inpatient, it's 1.5 months. The other 1.5 months is outpatient. And then over the course of our 3rd and 4th years, we do another 3 months of general inpatient at the VA. Outpatient rotations are numerous. So we have, musculoskeletal focused, neuromuscular focused, sports and chronic pain, a lot of hands-on fluoroscopic and ultrasound guided procedures, particularly because we don't work with fellows. We work kind of one-on-one with our attendings. And so we get to be the primary person doing these injections when they occur. We really work to get our residents hands-on experience early on during residency. And so we have an injection boot camp rotation for our PGY2s. We have you working with various outpatient faculty who do different types of injections, from, blind to ultrasound guided to interventional in the fluoro suite. We also have 3 months rotations in EMGs done with our neurology colleagues. We have outpatient cancer and an outpatient functional restoration rotation as well. Additionally, there are other opportunities for electives as kind of determined by our residents' interest while they're rotating with us. Thus far, really nothing I've heard has been off limits. It's really just whatever a resident is interested in, they have an option for. Didactic sessions. So we have a curriculum that repeats every 12 months, meaning that you'll see our full curriculum 3 times while you're here with us as a resident. We cover various different topics, including, how to perform and critically assess research. We have sessions on diversity, financial literacy, which becomes much more interesting in our 4th year. As a PGY2, it seems so far away, and now I'm, diligently taking notes when we have that session. And in addition, we have residents participating in journal club and M&M meetings, once each per year. So you'll participate 3 times while you're a resident with us. I alluded to this earlier, but we get a lot of one-on-one support as residents. Typically, we're working directly with a faculty. We're never on rotation, directly with another resident. We may be, in the same location, but you're always one-to-one with your faculty. Because we don't do our rotations with the interventional pain fellows, we're first in line for all of those procedures when we're with those attendings. While on the inpatient services, we do have support from NPs and PAs who help kind of offload the admissions, as well as, split patient list with, making it more manageable. And we're really, proud of our, resident mentorship program. We do our best to, pair each incoming resident with a faculty member whose interests kind of align with theirs. And we continue to reassess that relationship and try and, both formally, help residents find mentors, but also give them the freedom to find mentors informally as well. Something unique about our program is that we've recently incorporated a lifestyle medicine curriculum. We're one of, I believe at this point, only 4 PM&R residencies in the country to have a formal lifestyle medicine curriculum as part of our residency. It's not a requirement, but it's something that we enroll everyone into. And if it's something that they have an interest in, we make it very easy to, participate in. It's a mixture of self-directed online learning as well as some patient encounters. And if you complete the requirements, you'd be eligible to sit for board certification for the American College of Lifestyle Medicine, meaning that, you could end up double boarded without a fellowship right out of residency, which is, really unique. We have a lot of educational opportunities as part of the program, opportunities for sports event coverage, adaptive sports coverage through our RHI adaptive sports program. Elective months, I think we get our first elective month as a 3rd year, and then as a 4th year, I believe we have 4 elective months. And like I said earlier, it's really just what you have an interest in. Our program coordinator, Amy, is fantastic and is always able to, work with us to get the experiences that we want. And also during our didactics, we have, specific workshops to focus on ultrasound skills, injection skills, and EMG skills as well. In terms of fellowship opportunities, so within IU, we have a pediatric rehab fellowship based at Riley Children's Hospital, as well as an interventional pain medicine fellowship based out of the VA. One of our current residents did match to that interventional pain fellowship, and I think we've had someone match the past 3 or 4 years. Previous residents from our most recent graduate class, 3 went on to pain medicine, 1 at IU, 1 at University of Michigan, and 1 at University of Rochester. And then the 4th is doing a sports medicine fellowship at Nationwide Children's. So program does a really good job about, setting our residents up for success and fellowship and whatever their desired field is.
We have about 5 minutes left.
All right, thank you. We do have an iDream program, which is, trying to increase diversity recruitment within both the program and IU as a whole. This is available for both, residents as well as interested medical students. I believe there's more information on our program website. A little bit about our faculty. So our department chair is Dr. Hammond. She completed her residency at Baylor and then fellowship in TBI in Michigan, and she's been our chair since 2009. And she's very supportive of the residents and the residency. Assistant program directors, we have 3, Dr. DeVay, Dr. Cata Charles, and Dr. Ramsey Morrow, each who have a focus on, either education, quality improvement and diversity, as well as wellness and mentorship. So we really try and, take pride in our, diversity and mentorship efforts. Our inpatient faculty, we cover all of the, major disciplines: stroke, TBI, spinal cord, cancer. Outpatient faculty with numerous interests from musculoskeletal to neuromuscular diseases, sports, interventional procedures, long COVID, pain. Our VA faculty, who we work with, again, wide variety of interests within PM&R, spinal cord injury medicine, TBI, musculoskeletal, EMG, interventional pain, and non-interventional pain. Our EMG faculty is largely based out of the neurology department. Our pediatric faculty have 3 core faculty with Dr. Doshi, who recently joined us. And we also have a host of research faculty who are available to help residents with, any kind of project they could be interested in. I'll stop there to check the chat for any questions or allow for any questions that anybody wants to ask. Okay, I see one here where the outpatient rotations listed as 2 months each. Most of our outpatient rotations are 1 month each, but tend to repeat. So you'll have, IU outpatient rotations, once during 3rd year, again during 4th year. And then for rotations that you really enjoy or have an interest in, you can repeat them using an elective. The ones that are longer than 1 month are pediatric outpatient and EMG, which is 3 months. Those are the ones that specifically come to mind.
We have about 2 minutes left.
Nobody else has questions. I'll go through a little bit about, some of the things to do in Indianapolis. Let's see here. So it's a really great place to live, Circle City, crossroads of America, easy to get to a lot of places and a lot of things to do while you're here. We have a lot of outdoor spaces throughout the city, different concerts and events put on throughout the year along the canal in different parks throughout the city. We have a pretty fantastic zoo. I should have added pictures that I took when I took my family there. They have a really cool exhibit with kangaroos right now where you can walk around with the kangaroos and kind of touch them and pet them as long as they don't punch you, which is pretty cool. We have an excellent children's museum for, anyone who has kids or who's just young at heart. I know adults who've gone and have had more fun than their kids. An excellent state fair that happens every year, different street festivals, great national parks. We have Indiana Dunes up north, a couple hours north. Tons of sporting opportunities. We've got Colts, Pacers, Indy 11, soccer, minor league baseball as well. Pretty easy to get to the games. All of these are housed right downtown. Residents
That about wraps up the time. Sorry to cut you off. But yeah,
no worries.
Feel free to continue asking questions in the chat, and then if the IU representatives want to put their email into or their best contact information, they'll be able to possibly answer some questions further.